Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, for this Health Supplier segment. As we traverse the waters of healthcare, the changes that take place, sometimes they work out better for some than others. Trying to make healthcare work for everyone is usually front of mind with our physicians. To that end, a lot of times technology is in the forefront and plays a major role. Our guest in studio today is Dr. Michael Sherling. He's the Chief Medical Officer and co-founder of Modernizing Medicine, a company that aims to enhance the physician experience as it relates to giving better care and more efficient care. How are you doing today, Doctor?
Hey, how are you? Thanks so much for having me.
Thank you. Thank you for your time. Modernizing Medicine. You are the Chief Medical Officer and co-founder of this company. When did this company come into existence?
Great question. Actually, I was practicing dermatology in Lake Worth, Florida, which is in Palm Beach County in Southeast Florida. And it happened to be one of my patients who walked in literally for a routine skin exam, who happened to be a serial entrepreneur, and we got to chatting. I'm kind of a techie. Before medical school, I took a computer programming class in college and always wanted to do something entrepreneurial. But as I was chatting at my patient, I learned that he had founded a company called Blackboard, and as one of the co-founders, grew that in the education space to about 90% of the U.S. education market, and learned that I had somebody really who in front of me who had done amazing work, providing a solution to a field that really needed it. And healthcare in a lot of ways is in the dark ages. It physicians are still typing a lot of their notes into a computer, disconnected from their patients.
Absolutely.
That information that gets in, it's just so critical, doesn't really communicate well to other systems, so that patients don't have access to the information they need when they need it. Yeah. And at the time, which was in 2010, there's a huge need to really improve and provide a productivity tool for doctors, and one that would make patient care better. And Dan Kane is my co-founder. Really, he not only builds companies, but he builds software. And he said that he could build anything. And I said, we need to build something that makes physicians faster and improves healthcare. And so we came up with the electronic medical assistant, which is really a platform for improving healthcare. And the medical record system that we built, cut down my documentation time from, let's call it 5-10 minutes to under a minute.
Wow. That's amazing, because when I go to the doctor, they're sitting there, I see them for 4 minutes, they're, to me, sometimes completely disconnected with what I'm saying, because, they're required to put this information in. This information, as it's the same information, but you're helping physicians to not only improve how that information is created and transmitted so that, better treatment can be administered. But when it comes to the business side for the physician's practice, how is your software? I mean, above the efficiency of, cutting down 3 minutes to less than a minute. Okay, yeah, I get that. But when it comes to the bottom line, how much more are the physicians being able to keep what they're making as opposed to letting it go behind inefficiency?
No, that's a great point. The most precious resource of a physician is their time. And so if they're really spending a lot of time documenting their encounters, they can't spend more time with patients, and they can't see a lot of patients. So that is obviously one way of getting a return on investment from a business perspective. But healthcare is shifting, and we're moving away from fee-for-service. Fee-for-service is the traditional healthcare model that physicians get paid today, and which is, the more a physician orders, the more tests we order, the more procedures we do, the longer we spend with patients, the more money we get reimbursed. And that's changing because healthcare costs are skyrocketing, and it's unsustainable. And so there's something called value-based healthcare and alternative payment models, where doctors get paid by proving that they have higher quality and that they're spending less healthcare dollars per patient than their peers. And the software solution that we have, we're launching analytical tools that gives the provider insight, gauges, if you will, on what their quality is and what their costs are, so that they can change course during the year to improve, and that really has a huge impact on the bottom line. Other services that we provide include things like revenue cycle management and practice management, which we're launching this year, which are software tools that we use to collect claims data, claims from insurance companies for physicians, and we also have services that allow us to collect a higher percentage of receivables for physicians as well, on top of the value-based offerings that we have.
How seamlessly does your software interact with other types of coding software when it comes to getting paid?
Yeah, so diagnostic codes have changed. Actually, we're moving away from ICD-9 towards ICD-10, and instead of 13,000 codes, which are the ICD-9 codes that for decades doctors have been using, and they can memorize them. They're only 5 digits. They're basically a zip code. We're moving to ICD-10 codes, which are 7 digits. They're phone numbers. And instead of 13,000 codes, there's 120,000 codes. And what creates an ICD-10 code depends on not just the diagnosis itself, but where it's located on the body. And so when you're adding all of these complexities, it gets really complicated fast. Our system, because it captures structured data, because it's predominantly mobile, so it's on an iPad, it's cloud-based, and the physicians themselves, like we have 18 physicians on staff, so our physicians capture all of the structured knowledge. It automates things like ICD-10 codes. Okay. So physicians don't have to be bothered with any of that stuff. Instead of spending minutes after each encounter coding all of these things, CPT codes, ICD codes, modifiers, our software automates all of that and comes up with a bill based on what the clinical documentation itself.
That's amazing. We're talking about the face of healthcare shifting. We're talking about the coding, the way coding is done, going through a change. Medical practices are as unique as the doctors that build them. How does your software make changes, say from a dermatology practice to a kidney specialist practice, or to pediatrics?
That's a great question. Yeah, so great question. I think no two doctors practice the same. We spend 4 years of medical school, several years of residency, getting that specialty training to learn, our specialty. I'm a dermatologist. I practice, medicine on the skin, and, a urologist will practice, spend years operating on kidney diseases and the like. And from the very early, beginnings of the company, we said, I can't pretend to be a different specialty, and our customers would know immediately if it looked like a dermatologist built another specialty. So we hire 18 physicians, and each one of them is a different, specialty. And so we have several dermatologists on staff. We have, a urologist, several ophthalmologists, and we teach them how to code. Okay. Computer code. And they build this language and these relationships between the diagnoses, the plans, and the prescriptions, and it then works for them. And so the underlying platform, which is something the engineers build, think of it as this, very advanced, Nintendo, and then the game cartridges are coded by the doctors. And so whether you're putting in, a dermatology platform or you're putting in an ophthalmology, product, that code is determined by the physicians that not only code the product but also use it in practice.
Talking about the uniqueness of practices, if you're familiar with programming your playlist, say in Pandora, iHeartMedia, or something like that, if I like funk music and 9 of the songs are funk and 15 of them are country, with your software, does my interest get moved to the front, or do I still have to go through and look to find my interest, even though I like funk music and I want to do that today? Do I still have to weed out my country music?
That's an awesome question, and it really gets to what makes our software different or similar to softwares like Pandora, in that there's adaptive learning. And yes, the system comes day one with the knowledge of learning, all of the diagnoses of a given specialty. But if you like let's say you specialize in certain diseases within dermatology, you see a lot of patients with acne and psoriasis, and you do a lot of skin cancer, those diagnoses will rise so that you can see them front and center. You don't have to search for them or type in their names to find them. They're right there in front of you. And likewise, if you treat a disease a certain way over and over again, say you like certain techniques to remove a skin cancer, you use a 15-blade scalpel, you use 4O sutures to sew it up, it will remember that you like these sutures, this scalpel, this anesthesia to remove it, this prescription to treat it. And that adaptive learning works in much the same way like Pandora, in that it shows the doctor only what they need to see, when they need to see it. It remembers what they choose, and then the things that they do most commonly rise to the top. So they're not searching, they're not clicking, they're not typing. It's just in front of them.
Great. That's excellent. And as we wrap up, talk about some of the feedback that you're getting from not only physicians, but some of the support staff that has been trained in your, how to use your software. And then let's get just a little bit into the support that you offer. Okay.
Yeah, absolutely. We have tremendous amount of support team. We have, our company has about 500 employees, and so we have, I want to say, greater than 25% are in support and client services. And so, when physicians are very busy people, when they call in, they need an answer, pretty quickly. And so we want to be available for them. And it's not just support staff. These are people who have experience dealing with patients, have been involved in, being in the front office or the back office of a medical practice. And so they're talking to their peers, people who have been office managers or, at the front desk, or medical assistants who then can speak their language, understand what the workflow challenges are, and then communicate to the customer. And we were ranked by Medical Economics as the number one for customer service.
Where can our listeners get more information about Modernizing Medicine? You've got a website, yeah?
Absolutely. www.modmed.com is our website, and there you can see just the experience that physicians have using the iPad. It's very sleek. We're also launching a telemedicine application as well for patients, so that patients who are treated by our dermatologists can be seen remotely, taking pictures of their conditions and forwarding them on using the technology. So we're very pro-patient, pro-technology.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. It's been a pleasure talking in studio this afternoon with Dr. Michael Sherling, Chief Medical Officer and co-founder of Modernizing Medicine. Modernizing Medicine is a firm that's transforming how healthcare information is created, consumed, and utilized in order to increase efficiency and improve outcomes overall, both for the patient and for the physicians themselves. Now, Dr. Sherling, as the co-founder, is responsible for developing and designing the dermatology-based software and supervising the design of Modernizing Medicine's other EMA specialties. Great having you here with us today, Doctor.
Thanks so much, Neal. I really appreciate it.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to our podcast on iTunes.